This clip is sponsored by Med Travelers. If you're an SLP interested in travel therapy, visit medtravelers.com to get started. What is happening? And I know this could be different, but for the most part, can you break down what is physiologically happening in the mouth when we produce R? And that's, I think, will help us see why it is so difficult and to produce.
Yes, I can. And I can thanks to Preston et al. 2020. So if you've never read this article, it's free open access on ASHA. Jonathan Preston is out of Syracuse, and him and a whole bunch of other people, they do ultrasound imaging all the time.
Cool.
So I feel like anything that they watch the tongue do its thing constantly. Mm-hmm. So they're pretty trustworthy, smarty pants people. Anyway, so now this is me interjecting. I focus on 3 key components, but there are 5 that I'm going to talk to you about.
Okay.
So first things first, the tongue is retracted. So it slides back in the mouth. Not next, there's no specific order. I'm just listing them. We need side elevation. So you might hear it spoken about like lateral bracing. So the sides of the tongue are elevated and they're touching either the top molars or just inside the molars along the gums. So you slide it back, sides are up.
Yep.
We also need tongue tip elevation. And I would say the tongue tip placement is the main difference between whether it's technically a bunched or a retroflex R. I used to feel so passionately that some kids can do one, some kids do the other, some kids can do the other. The more I learn, the more I'm convinced maybe it doesn't matter so much, and who knows what they're really doing, or I don't know how big of a difference there really is, because there's so many people who use some kind of mesh of the two, or they switch between them depending on the context, or they start with retroflex, they morph into bunched.
Can you give examples of those two? Because I'm feeling like I need even a refresher on what's an example of those two, just for.
So whenever I talk about, a bunched tongue placement is basically, I think about it like a turtle retracting its head in its shell. It's more of a tongue just sliding straight back.
Okay.
That's how I think of it. But the sides are still up, right? Tongue retraction. And we do still have some amount of tongue tip elevation. But for retroflex, it's more like the tongue is doing a backflip. The tip kind of curls back a little bit more. So I'll tell students to curl it back about halfway. Sometimes I'll tap the top of their head to kind of show them where I want their tongue tip pointing, but we don't touch the roof of our mouth. But for retroflex, you also want side elevation. You also want tongue retraction. So no matter what you're doing for the R, side elevation, tongue retraction, tip elevation.
And to some kids, so the bunched and retroflex, it's not like one is right, one is wrong. It's just a different way. Some will produce it one way and some another. And so understanding, and is it just something where we're either one or the other and we just naturally do one or the other for the most part without thinking like I'm going to do this with my tongue or that. So part of what you want to do is figure out which type they are.
Yes and no. So people will, neither one is better than the other. Well, some people feel strongly that retroflex is harder to generalize because it seems like it takes a little bit more, I don't know, it takes more time to get into the position, I guess. So it just doesn't seem to, it's harder to say it quickly. Right.
So it seems harder because I'm like doing this as you're talking, like with my tongue, and I'm thinking, gosh, what am I? Like, I don't know. But I'm also thinking that does feel harder to do that retroflex than bunched.
Some people use it though, naturally. They just,
Yeah. Yeah.
and they probably never even realized it. And neither is better than the other.
Okay.
Some people feel strongly that retroflex makes it harder to generalize.
Mhm.
My argument is, okay, how long are you willing to stay at the elicitation phase? Like, if you're just like,
Yeah.
no, it has to be bunched, I mean, I would rather make progress and worry about speeding it up later. Because some people start retroflex and then it morphs into bunched. Because I like all the time when I'm assessing a kid and I ask them to retract their tongue, I don't use those words, but when that's what I'm asking for, I'll see their little tongue flip back and I'm like, okay, so let's run with that. That's fine. I mean, neither one is better than the other. I tend to find retroflex a little easier to teach. It seems like kids understand, or just naturally that's what they seem to do. And it's easier to see because you can look in a mirror and see underneath the tongue. And that gives you a hint of if they're at least trying to use their R at the time.
Yeah. Okay. So so now that we've got, thank you for that, because I was like,
Yeah.
I don't remember learning about that. So that's helpful. So, okay. So, and then after that step, where are we at?
So the three main things, right? We have side elevation, tongue retraction, tongue tip elevation.
Okay.
So by default, the back of the tongue is lower than the tip, right? That's the fourth thing. And the fifth thing, and this is probably a little bit controversial too, is a little bit of lip rounding.
Gosh, I feel like I don't know how to make an R now. I was like, do I even know how to make this sound? So I'm thinking, okay, did I lip round? So let's see.
A little tiny bit. It's not.
It's very minor. Yeah.
Very minor.
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 See, I did it again.
And, it's funny. And I've done this too. So many of us will cue kids to smile because we're trying to, get rid of that W that they want to sneak in there. But it's more of a phonological issue, typically. Anyway, so smiling is not necessarily the correct position that we say the R sound in. Now, for some, depending on the context of the word, if I'm saying ear, then my lips are probably a little bit more retracted than they would be otherwise. Just because I'm coming out of an E. Yeah, the context. But yeah, lip rounding is actually pretty important. And I just started with a kiddo who as soon as I explained to her that, because she was bracing like this when she said her R, and as soon as we added just a little bit of lip rounding, it sounded so much better.
Well, and when you're explaining what has to happen, well, no wonder.
I know, right?
How do any of us make this sound? It's like, it's so complicated.